Hello class, hopefully you're enjoying the presentation so far. Today I'm going to be talking about the Affordable Care Act and the new benefits that it will bring to persons with disabilities. Under the new Affordable Care Act, some of the benefits will include essential health benefits, changes in health care insurance, creating a temporary high-risk insurance pool, talk about home and community-based services, what class is, and the community first choice option. Essential health benefits. So under the essential health benefits, the U.S. Secretary of Health and Human Services will now be able to determine coverage decisions, reimbursement rates, incentive programs, or design benefits in ways that do not discriminate against individuals because of their age, disability, or expected length of life. Some of the changes that in health care insurance include no longer will they be able to deny coverage based on previous conditions, guarantee the renewability of coverage, no longer can they bar lifetime and annual limits on coverage, prohibit cost sharing for certain preventable services, no longer exclude preferred providers that specialize or have disproportionate share of patients with disabilities, and they'll also cover rehabilitative and habilitative services and devices. The temporary high-risk insurance pool. Between now and 2014, people with pre-existing conditions are eligible to purchase coverage. To be eligible, you must have a pre-existing condition consistent with guidance by the Secretary of Health and Human Services, without any health coverage for at least 6 months, and also be a citizen of the United States. Home and community-based services. These new services will allow persons with disabilities or chronic conditions to live at home where they feel most comfortable, no longer forcing them into nursing homes or other institutional facilities to receive the care they need. The Community Living Assistance Services and Support, or otherwise known as CLASS. This is a national voluntary insurance program. The benefits will include not less than $50 per day for services that support activities of daily living. To qualify for this service, people must pay premiums by voluntary payroll deduction plans for at least 5 years, and then they will receive the benefits within the service. The Community First Choice option. This will allow state Medicaid plans to choose home and community-based services as the rule rather than the exception. Eligible for individuals with disabilities with incomes up to 150% of the federal poverty level who would otherwise require institutional care. And so to encourage states to choose this option, states that opt will receive an additional 6% to the federal share of Medicaid cost, otherwise known as the Federal Matching Assistance Percentage, for 5 years. So as you can see, there'll be some new benefits and ways for persons with disabilities to access health care that might not have been available to them prior to the signing of the Affordable Care Act.